Welcome to SciFlux, the stream of scientific progress. Every day, we bring you the world's latest research so you can stay ahead, informed, inspired, and connected to discovery. Today's video is about medical breakthroughs. We start by sharing this amazing work. Severe knee osteoarthritis can be crippling, and for patients with Class 2 obesity, the path to relief often narrows to surgery. But when the decision comes down to a partial knee replacement or a total knee replacement, the right choice isn't always obvious. A recent study tackled this head-on by analyzing real-world outcomes from patients with anteromedial knee osteoarthritis and higher body weight. The objective was clear: identify which procedure delivers a faster, smoother recovery, stronger functional gains, and measurable improvements in daily quality of life. The results give clinicians a sharper decision-making framework. Instead of relying on generalized assumptions, surgeons can tailor the surgical choice to the patient's specific profile. And for patients, the data offers something critical: a clearer, evidence-based pathway toward meaningful, lasting mobility and reduced pain. Moving on to another study, this next paper examines a critical decision point for millions living with severe knee osteoarthritis, particularly those with Class 2 obesity, where surgical options often define the path to real pain relief. Patients and clinicians frequently face a key question: is a partial knee replacement or a total knee replacement the better choice? To clarify this, researchers analyzed real patient data from individuals with anteromedial knee osteoarthritis and higher body weight. Their aim was straightforward: determine which procedure supports a smoother early recovery, stronger functional improvements, and a more reliable return to daily mobility. The findings offer practical guidance. Surgeons gain a more precise framework for selecting the most effective intervention, and patients receive clearer expectations grounded in evidence. Ultimately, this study helps refine surgical decision-making for a complex patient group, improving the route toward lasting relief and improved quality of life. Next in the lineup is a review that tackles a growing diagnostic challenge in modern pulmonology. As lung cancer screening expands, clinicians are increasingly required to navigate a microscopic maze inside the lungs to locate lesions only a few millimeters in size. Advanced tools like robotic bronchoscopy and electromagnetic navigation are transforming the field. But this study highlights a compelling reality: the most dependable method often remains the most fundamental. The authors emphasize that systematic airway mapping using standard CT scans, executed with precision and solid clinical judgment, can match or even outperform automated high-tech systems. Their analysis reinforces a strategic message for clinical practice: core navigational skills are still a critical asset. In an environment dominated by innovation, this review underscores that disciplined, back-to-basics technique continues to play a decisive role in securing accurate, life-saving diagnoses. Next, we move to a study focused on what shapes the making of a truly effective doctor: not just technical skill, but professionalism, communication, ethics, accountability, and empathy. In Singapore, educators needed a reliable way to measure these qualities within their own cultural and clinical context. At SingHealth Singapore General Hospital, researchers adapted the Professionalism Mini-Evaluation Exercise, or P-MEX, creating a Singapore-specific version for medical residents. Their goal was to test whether this tool was valid, reliable, and relevant to local expectations. They performed a full review, faculty confirmed the content, statistical comparisons validated its structure, and internal consistency checks showed it performed dependably. Factor analysis added a key insight: the original four-factor model didn't fully apply. Instead, a clearer two-factor structure emerged, centered on patient care and teamwork and reflective skills. The takeaway is strategic. Professionalism may be universal, but its expression varies by culture. Meaningful assessment requires thoughtful adaptation. With this refined P-MEX, Singapore's residency program gains a more accurate way to evaluate not just what doctors know, but who they are, supporting the development of competent, ethical, and genuinely patient-centered clinicians. Moving on, the next paper tackles one of the most persistent challenges in modern healthcare: burnout among clinicians. This isn't just personal stress. It's a systemic issue that affects patient outcomes, hospital performance, and the stability of health systems worldwide. To address this, researchers highlight the Mindful Practice in Medicine program, or MPIM, developed at the University of Rochester. Built on 2 decades of evidence, MPIM strengthens self-awareness, emotional intelligence, teamwork, and compassion, qualities that reconnect clinicians with purpose. Studies consistently show reduced burnout, higher empathy, and better patient care. The real question is scale, and the answer lies in training facilitators who bring MPIM into medical schools, residency programs, and healthcare institutions around the world. This distributed model is already working across Switzerland, the US, the UK, Australia, and Canada, proving adaptable and impactful. The takeaway is straightforward. By embedding mindfulness into the culture of medicine, MPIM is helping shift entire systems toward healthier, more resilient, and more human-centered care. When the people caring for patients are supported, everyone benefits. Next, we move to a study examining one of healthcare's most critical competencies, communication. From delivering hard news to managing tense moments, effective communication defines patient experience, yet many students receive limited practical training. Researchers address this by applying the theory of planned behavior to redesign how communication is taught, aiming to shape students' attitudes, confidence, and sense of responsibility, not just their technique. They reviewed several years of evaluations from an interprofessional group of medical, nursing, and therapy students. The results were clear: hands-on activities, teamwork across professions, and community engagement significantly strengthen students' confidence and ability to handle challenging interactions, despite some complexity in group dynamics. The takeaway is straightforward. Communication training grounded in behavioral theory doesn't just build skill, it builds mindset. It prepares future clinicians to communicate with clarity, empathy, and professionalism. Next, we move to a study from Indonesia examining how medical students build resilience, a critical skill in a high-pressure profession. Instead of traditional lectures, researchers used a reflective bioethics workshop, then asked students to complete resilience assessments and share what keeps them steady. 4 themes stood out: faith as a source of strength, adaptation to changing challenges, self-management of stress and emotions, relationships that provide support. These insights emerge naturally through reflection, not direct teaching. The study highlights that resilience develops through awareness, connection, and balanced coping, essential foundations for future clinicians. Next, we turn to pediatric surgery, where anesthesia is both life-saving and delicate. Giving children anesthesia requires precision, expertise, and constant monitoring, since even small errors can have major consequences. This study looked at which drugs are most commonly used for safe, effective sedation. For full-body anesthesia, propofol often induces sleep quickly, fentanyl or remifentanil manage pain, and ketamine helps maintain vital reflexes. Each choice carries risks and must be tailored to the child's weight and procedure. The key takeaway: pediatric anesthesia is not just about medicine. It's a careful blend of skill, vigilance, and compassion to ensure every child wakes safely to a healthier tomorrow. Next, we look at a stark reminder of how a common infection can turn life-threatening. Ascariasis, caused by the roundworm Ascaris lumbricoides, affects up to 1 billion people worldwide, mostly children in areas with poor sanitation. A recent case in Paraguay involved a 3-year-old girl with severe stomach pain and vomiting. Imaging revealed her small intestine completely blocked by a mass of worms. Emergency surgery was the only option. Surgeons carefully removed the obstruction, saving her life. This case highlights that while ascariasis is preventable, it remains deadly where clean water and hygiene are limited. Education, sanitation, and timely treatment are key to turning these dangers into stories of survival. Finally, we explore an innovative approach to a daily challenge for people with Parkinson's disease: swallowing. Dysphagia, difficulty swallowing, can lead to choking, malnutrition, and pneumonia, making it a serious concern. Researchers asked whether combining speech therapy with music could help. After reviewing hundreds of studies, they focused on two: one using choral singing with vocal exercises, the other blending traditional speech therapy with music-based breathing and singing routines. The results were promising. Patients showed improved swallowing and better control. While more research is needed, this combination of speech and music offers hope, helping Parkinson's patients regain rhythm and safety, one swallow at a time. That's it for this video. If you want to stay updated with the latest scientific discoveries, don't forget to subscribe to SciFlux channel, leave a like and a comment. See you next video.